1,000 emails a day.
Yes, ma'am.
All right. So, good morning, everyone. Happy Halloween. I'm so glad you were able to join us, and we'll let Lee get our meeting started off.
Thank you, Heather. And thank you, everybody, for being on here. I won't take but just a second, and I may get back on and talk more later, but we'll go over some things today, a couple of new plans and rates for Blue Cross. I think the thing I want to start out by saying is with all the turmoil going on with ACA, we are very fortunate to have the plans to offer next year that we have to offer. And me and Heather have kind of been joking around with each other that if we don't have a good year with ACA this year, it's our fault. It's not Blue Cross's because they have knocked it out of the park for us. So there's a couple of new plans that Heather will go over and highlight, but we're just excited. We're really excited about this year in ACA. We do hope that those enhanced tax credits get fixed. Then everything's going to be fine. But Heather, I'm excited for you to share what you've got today, and thank you everybody for being on here.
Thanks, Lee. Brent, do you have anything you want to say to get us started?
Yeah, I just want to say, wow, it's finally here. And thank you all very much. I agree with Lee. I think from a rate standpoint, our plans are positioned very well. Unfortunately, what I've seen in looking at existing customers, the premiums went up more than the tax credits went up. So our existing members, your customers, are going to pay a little bit more out of their pocket. But we are positioned very well, really throughout the state. There's some areas where we have the top 4 plans or the least expensive plans. So we're excited about that. I know Heather's going to spend a lot of time talking about our statewide EPO, which is a new plan for us this year. We're very excited about that. One thing I haven't seen, and Heather and Leah know, and probably all of you have looked around on the plan preview, I'm not seeing any silver plans with a $0 premium, even at the 94% cost sharing level. So it's going to be adjustment for those folks. If they are used to not paying anything, their tax credits covering the entire premium, it looks like they're going to have a small premium going into 26. You can't beat the benefits at that level. Those are the best benefits you'll ever find. But it's something that I know your customers are going to be asking about. So we're here to support you. Robin Brooks does a great job for us. So we're happy to answer any questions.
Thank you, Brent. Thank you for being on here with us today. So yeah, what we'll do is I'll just jump right in. I'm going to change over to my Health Sherpa account. Can everybody see the screen I'm sharing now, which is my Health Sherpa?
Not
Lee
yet.
or Brent?
Not yet, Heather.
Not yet. Okay. Technology and I seem to still not always agree. All right. I think this may work. How about now?
Yes.
Okay, great. All right. So here's my Health Sherpa account. I did a quote here just for my zip code, which is 35633. And I put in a 47-year-old female, non-tobacco user. No, none of these things apply. Just a household of one and $16,000. She's just barely getting in to get a tax credit. So as Brent was talking about, in 2025, she's had a zero premium. And I know a lot of us have a lot of people like that. We've had them in this select silver. They've had a zero premium, zero deductible, and that has been fantastic. So let's look at what she would be looking at for 2026. So let me update. Okay, so she's still, eligible for a tax credit and eligible for cost share reductions. So for now, we'll just skip over these bronze plans because we want to look at what she would get with the cost share reduction, because remember, those only apply to silver plans. So let's look. I particularly want to compare this new statewide silver EPO because I was super happy to see that would only be $8. And, I think even though she's been used to a zero premium, $8 is not going to break somebody. People spend that much on like a cup of coffee or something at Starbucks. So I feel like $8 is not going to be too bad. That select silver plan she's been in, notice it would go up to $30.07. And so, that would begin to give people, especially at that income, some hesitation, because I know that, can turn out to be a lot of money for someone when they're on a really tight budget. So that's why I felt like that this EPO plan might be a particularly good option for some of the people that have been on a zero plan and maybe they don't want to pay $30, but they could pay $8. And so Brent, Robin, Lee, everybody feel free to just jump in and add to this as I kind of just compare these two plans. If you notice the deductible, you do have a 150 deductible. And now remember, she's getting cost share reduction. So that number and the co-pays and co-insurances, all that's going to vary by cost share level. But just here for a 94%, let's look at these numbers. So she would only still have a $150 deductible, which is not bad. The max out of pocket, there's not, only $25 difference. So that really wouldn't make a lot of difference. Now, the network, the EPO versus PPO, I know that a lot of agents have kind of wanted to stay away when they hear that EPO, but I think what maybe is causing some confusion is that in the past, and Robin and Brent, feel free to jump in on this part, but the EPO in the past has been in the counties around Birmingham, and that network has been more limited to the high performance network. But this statewide EPO is different. And if I'm not mistaken, it's going to have the same network as the PPO plans. So those preferred medical doctors, the PMD, when you look at that on the network, those doctors are still going to be in this network. I think the main thing is going to be the out of state coverage. Robin or Brent, do y'all want to comment on that network for the statewide EPO?
I do, Heather. And really, when we talked about developing and implementing a new plan, our options were if we could not enter with a new PPO plan, we would have had to have closed either Select Silver or Value Silver, but we could implement this new plan as an EPO. But Heather's exactly right. It's the same Select network as Blue Select Silver. So the network is not a true EPO. The EPO we have in Birmingham is tied to St. Vincent's. This is completely different. So this statewide EPO, all of the hospitals in Alabama would be in the network. Wow. And again, most 90+% of the doctors would be in that network. You still have to designate a primary care select doctor. And you also have to get referrals to see a specialist.
Thank you, Brent.
Brent,
Yep.
I'm sorry to jump in. I apologize.
No, I
want
want you to.
Though, it's not really, though, a PPO plan because it doesn't have out-of-state coverage.
Correct.
It just has medical emergency out-of-state. So I kind of wanted to throw that out there.
I think that's an excellent point.
Yes, thank you, Robin. Yeah.
Brent,
go ahead, Lee.
well, when we were talking about this yesterday, just to relate it to Medicare, this new EPO plan it's kind of like a statewide HMO in a way in the Medicare world, where you got tons of in-state network coverage, but it doesn't go out of the state. And then there's no out-of-network coverage. It almost mirrors what an HMO would be in the Medicare world.
I think that's a good comparison. One thing to be careful with, we do have in the contiguous counties in Georgia and Mississippi and Florida, probably Tennessee too. There are some doctors that may be in Georgia that are part of our select network. They can still designate those as primary care doctors, but they would need to be careful because if they went to a hospital in another state, it wouldn't be covered. So that's something. They can still use those primary care doctors as long as they're designated as select doctors in our network. But if that doctor were to refer them to an out-of-state hospital or specialist, they would not be covered.
That's a good point. That's something very important for agents to remember, especially those close to the border, because that comes up a lot.
Yep.
So we'll.
Hey, Heather,
Yeah.
Can I ask a question? Hey,
Yeah,
this is Matt
I want
Brazier
you
down in
to.
Hamilton.
Yeah. Hey.
Yeah, if what I'm hearing is if I'm understanding it correctly, see, our hospital here in Marion County is owned by Tupelo, and so is our hospital in Winfield here in Marion County. Every referral that goes through our two hospitals in this county is going to cross that state line over to Tupelo because they're going to refer them across the state line. So that EPO is probably not a good choice for somebody here in my county at all. Same thing for Lamar County, Sulligent. They go to Amory a lot, which is also owned by Tupelo.
Yeah, I would agree with that, Matt.
Yeah.
Okay.
Yeah. So people on these border counties, you will have to be very careful about that when you recommend this plan or look at this plan. So just quickly looking through these other benefits, you do see the primary care doctor visits only $5 compared to $15 on the Select Silver. The specialist is a little more. Now, we will in just a second, when we deep dive into this EPO plan, there's some major differences with the prescription, so in the tiers. So we want to look at that more closely here in a second. But generic drugs, that's still very affordable.
Oh, wow. That's a great outfit.
And
Oh, how old is she?
I think somebody's got some trick-or-treaters maybe coming into the office. All right, and then so on some lab services, emergency rooms, in just a second, we're going to look more closely at that summary of benefits. The deductible is going to apply to more things on this EPO plan, and we'll look at that very closely in just a second. So you're seeing that here. Let me go ahead and pull up this summary of benefits, or it's more like important questions, I guess you would say. I hope everybody can see that well enough on your screen.
We can.
Okay, great. So, on this plan, we see here the individual deductible and family deductible. And Brent and Robin, y'all just jump in anytime. And if somebody has a question, jump in. So, of course, you still have your preventive services that are going to be covered at no charge before your deductible. Your tier 1 and tier 2 drugs will be covered before the deductible, and then some pediatric, dental services. And then the out of network. Now, remember, this is the 94%. So these out of pockets, deductibles, and copays, co-insurances, all of that will
Mom
vary.
said, do we want an egg sandwich?
Oh.
Yeah.
An egg sandwich sounds pretty good. Hey, Lee, can you handle
You won't eat an
the
egg sandwich?
chat and
You won't eat an egg sandwich?
I'll
Bologna on
try. Let's see.
That egg sandwich sounds really good.
It
It does sound good.
Well, do you want me to tell her no?
Yeah, eat an egg sandwich.
Oh, well, I was going to eat an egg sandwich.
Heather,
Let me get back over there and see if I can mute.
I don't have any admin privileges here.
Oh, I'm so
He
sorry.
said he don't want one. So I guess I won't
Okay.
eat one.
The human element's the part you just can't replace.
Oh my goodness. Okay, I'm just going to mute everybody, but Lee or Robin, Brent, feel, or anybody else, if you want to speak up, unmute yourself. All right, now let's see if I can get back to what I was here to the. Now, can everybody see the summary, these questions again?
Yes.
Okay, perfect. All right, and I see we've got questions in the chat. If I will try to get back to those in a minute, we'll look at those. But so for now, I think I was about down to here, maybe about the, out of pocket, of course, so nothing that is out of network is going to contribute to that max out of pocket. Is that correct, Brent and Robin? Except for emergency medical services, nothing else out of state or out of network would contribute.
Can you unmute yourself, Robin? I think that's correct, Heather.
Okay. All right.
Hey, my audio cut out for a second. Can you repeat that?
Well, I was just pointing out here about the out-of-pocket limit. Anything out of network except for emergency services would not go toward the max out-of-pocket.
That's my understanding as well.
Okay. All right. And then, we've talked a little bit about the network already. You do have to have a primary care doctor in that select network or the plan's not going to pay anything. It's just like it is with the standardized and the select plans and the Saver Silver. And we'll talk a little bit more. If you're not familiar with how to find those select doctors or designate those, we'll talk about that a little bit later. But you would have to have a select primary care doctor designated in order for the plan to pay anything. And you do have to get a referral from that select primary care doctor in order to see a specialist. All right, and then moving right along, you can see these copays here. Remember, this is for 94%. Preventive care, still no charge, and the deductible does not apply to any of those. But notice over here, out of network, nothing is going to be covered. So you just have to make sure the member understands that. And that out of network is basically going to be out of state, except for an emergency. Now, here was some other things that I noticed. When you get down here to the test, the diagnostic test, on the Select Silver, the deductible does not apply on some of these things. But notice on these, the deductible would apply. So if someone has blood work or x-ray or a PT scan, whatever, a CT scan, they're going to have to meet that deductible before the insurance is going to start to pay. So, on this plan, that's not a big deal because that deductible, I think, was only $150. But if someone's not getting the cost share, they would just need to be aware that, the deductible applies to all of, to those things. Now, this is where, another big thing you would want to check. The deductible does not apply to the tier 1 and tier 2 drugs. But 3 through 6, you are going to have to meet the deductible before, they're going to be covered. Like I said, on this plan, it's not a big deal because it's cost share, the deductible's low. But if someone's not getting cost share and they're on a tier 3 drug, you're going to need to really look at that closely because this probably wouldn't be a good plan for them. So, always remember to check those drugs. And if you're not sure how to do that, I've got a video about it, or I can help you with that. But be aware that the deductible, applies to those tier 3 through 6 drugs, and that's not the case on the Select Silver. So that would be another major difference. And I'm kind of just comparing this a lot to the Select Silver because I know that's a very popular plan, and we all have a lot of people in that plan, especially if they have had a zero premium plan. Now, if anybody has a question, feel free to jump in or want to add anything. Notice the deductible will apply to, these things as well. Now, urgent care, that is something that I wanted to ask Robin and Brent about. I see that the deductible does not apply, and I actually had this down in our questions, but I get this a lot from agents or just from even some of my own members that have been in the select plan, and they have a designated select doctor, but maybe that doctor isn't open on the weekends, and then they wake up sick with the flu and they go to an urgent care. And I hear back a lot that they've had to pay the full cash price because the urgent care facility will say, well, we don't have a referral, or we're not your, primary care doctor. And so, Robin or Brent, how could we educate our members, or is it the facilities? What is happening with that? How can they get that urgent care covered if their primary care doctor is unavailable?
Well, let me ask a question to clarify. Are these facilities places charging them upfront at the time of visit, or is this something that's coming back on a bill?
Well, just particularly one girl that I'm thinking about, she had just called me the other day and she said, well, they made me just pay the cash price. So in her situation, that's just the latest one that I could think of. But I have heard that even from other agents, they'll say, well, we can't get urgent care on this. They've been on the select plan, because they don't have, that's not their select primary care doctor. So, just kind of talk to us about that. What do we need to do to educate ourselves better and our members better, or maybe even the facilities?
Hey, Robin, I thought we relaxed that on urgent care a year or two ago, because that was a big issue a couple years ago where you had to have a referral to urgent care. But I thought urgent care and OBGYN were the two instances where you did need a referral. Is that accurate, Robin?
I am pulling up the criteria right now. Bear with me just a second. I'm sorry.
No, thank you. This is just something that that comes up a lot, and I just
It
wanted
does.
everybody to have as much clarification on that as possible.
Now, I will say this, which is kind of why I asked that question. I've had a couple of examples that, let's see, that were sent to me where it didn't qualify for urgent care. And so it processed out of network. Excuse me. And this would be like a lady, I think we had one where the lady had went on a Tuesday afternoon in her area, didn't try to see her primary doctor, just didn't feel like driving that far, I think was the excuse, and went to her local urgent care, and it wasn't the flu, it wasn't COVID, she just had a little, they said, I believe it was a cold, just a basic cold. Well, it was in the middle of the day, non-holiday, during the week, and it didn't qualify for urgent care, It wasn't like she was out of town or a weekend or holiday, so it processed out of network. So that's why I asked that. It's got to actually be, urgent care is kind of like after hours, holidays, out of area. Now, we did have one that was in the area, but their doctor could not see them. So they had to go to an urgent care. It filed out of network. It took a little time, but they appealed it with information that the doctor had wrote out a letter that she tried to see them and they could not, and they couldn't get her call back in time, I think, is one of the issues. So she had won her appeal, but I just kind of want to throw that out there because it still needs to actually be urgent care. You can't just walk in there just kind of anytime you want for no reason at all. It's got to be considered reasonable that you could not receive services.
That makes a lot of sense.
Let's see.
Yeah. That makes a lot of sense, and that may explain what the situation was with my member that called me not long ago.
I'm having a few connection issues, so bear with me just a second. I don't know if y'all want to talk for a second while I pull this up, but I'm trying to pull up that criteria. I apologize.
No, go right ahead. And so on the
Robin's got a
note
screw loose.
of, thank you, Robin.
Hey, Heather, I know Kevin put something in the chat that they've had similar questions from providers.
Okay, about the urgent care.
Yeah.
So it may be this criteria that we need to make sure that we as agents understand, and then we educate our members on that as well.
I do agree that I think there's some provider education, because we've also had the instance where a provider told them they were made a customer pay up front because it was a select plan, and they, but it qualified for urgent care. The lady had COVID, it qualified for urgent care, and they made her pay up front. We worked, when we got the report of it, I had the providers affairs team reach out to that provider and instruct them, kind of how that works, and they ended up filing the claim and having to reimburse the member. So I just kind of want to throw that. There's definitely some minor issues.
Okay. Yeah, I know. I will hear sometimes when a member will call, they'll say, what do I have to do to get out of this BEG plan? Because that's the prefix.
Yep.
Because they'll say, when I went to urgent care, they said, well, it's because I have a BEG plan that I'm having to pay. And so I just wanted to be sure that we all as agents understood, and we were able to direct our members in the right way so that they could get urgent care if it's needed. But the criteria, I guess, is what we all need to be more aware of. Robin, can you still hear us, or did you have some connection issues?
It's a little bit better. I don't know if it's just my internet or what. Just having some connection issues with our server. I did pull the information just now. As of 1/1/2024, qualified care services do not require our designation or a referral.
Okay, perfect. But it does need to be true urgent care. You need to not be able to see your primary care doctor, and it needs to be something of a more urgent nature. Would that kind of define the criteria?
Yeah, it says that under urgent care, it must meet one of the following 3 criteria. Let's see, after hours, beginning at 6 p.m. Monday through Friday, and also waived on weekends and federally recognized holidays, Labor Day, Thanksgiving Day, Christmas Day, or after hours on any given day with a qualifying urgent emergency code. So that's kind of the basic criteria they're looking at. It's got to be a qualified facility. They're typically looking at being out of area after hours, which classifies at 6 p.m. Monday through Friday. And so, weekends would be after hours, obviously, anything after 6 p.m. during the week, any federally recognized holiday, just that's kind of the basic criteria. But they can be appealed if it's a situation like that one I just told you a minute ago. It'll be a little bit of a process, but if there was a reason, even though they were locally, they couldn't get into their doctor or get a referral from their doctor to see somebody else, then there is an appeal process for it.
Okay. Thank you, Robin. And I do want to point out that urgent care is not covered. So if someone was, out of state and say they thought they had the flu, they would not be covered if they went to an urgent care. In that case, they would just be responsible for the cash price. Is that correct?
Yeah, I
Yes.
think out of state, Heather, it would default to the true medical emergency guidelines, which, sinus infection wouldn't be considered a true medical emergency.
Okay. Yes, I was noticing here, that the emergency care was more defined here as.
Yeah.
So, okay. So just, everyone needs to be aware of that. I think this is going to come down a lot to just educating members about what is covered and what's not, and making sure we take time to go over this with our members. I know it's, it's a lot to go over, but we need to make sure that they understand what their coverage is so that they can make an informed decision about the plan they want.
Yeah.
So,
Hey, Heather,
yeah.
Kevin put in the chat, and I think it's a really good point. It is challenging because I know my primary care doctor, if you've got sinus infection, COVID, flu, they don't want to see you at all. They want you to go to urgent care. We know you don't need a referral to go to urgent care. I would say this to Kevin and the rest of the group. If you hear from one of your members that a provider, an urgent care provider, let us look at that example and let us get our network team involved to see if there's some provider education, but we can at least reach out to them. Our provider team would, and make sure they understand, hey, these EEG contracts don't require a referral. But let us look at those examples.
Okay, that's good. So we would just maybe need to email Robin if we have some of those situations arise, email Robin and then see if there's something that could be done at that point as far as educating or an appeal. Would that be your suggestion? Okay.
Yep.
Well, that's good. I'm glad we got to talk about that more because I know that's something that comes up a lot. All right. And so, just notice the deductible is going to apply on the hospital stays. Outpatient services, though, here, this is for mental health. The deductible would not apply. So just going through this, it's, you can look through that yourself. And so is there anything else that anybody wants to add or ask or say about this before we move on to something else? Okay. So let's go back now. I'm going to go back to my Health Sherpa. And let's just go back to show all plans. We're still on this 47-year-old lady here in Florence. I did want to point out that there are two of these statewide EPO plans. It's the statewide silver and then the standardized statewide silver. And, we can see some of the differences. Of course, the premium is lower on this one. The deductible's lower on that one. Out of pocket, there's a difference. Robin or Brent, is there anything y'all kind of want to add about comparing these two plans, or is it just basically kind of the same network that we talked about? You just have to look at the summary of benefits, or is there any other big notable difference between these plans other than what we can obviously see?
I think it's similar to just, we're required to offer the standardized plans. So to me, the statewide silver EPO versus the standardized statewide silver EPO, obviously you can see the difference in the premium. One has a deductible, one doesn't. But I think a lot of the other benefits are very comparable and similar. So you may have to do some math on, is that deductible worth the $19 difference in the premium to have that $150 deductible on the first plan we looked at? But same network, select network, all that remains the same.
Okay, thank you. So now it's not showing because I have a Florence zip code in here, but I do want to just for a second point out that this statewide EPO is not the same as the other EPO. So
You
Brent,
can
what is it? Yeah, tell me the zip code.
35244 is Jefferson County.
Okay. All right. So I just want to make sure there's no misunderstanding about these two. So this Blue Saver EPO, that is not the statewide EPO. So if you live around Birmingham, is it 7 counties, Brent, around?
Seven counties.
Okay. So if you live in those 7 counties around Birmingham, you'll see this EPO plan. You'll see these EPO plans. So just be sure that you look for that word statewide, because that's going to be the difference. Because these EPO plans do have a much more restrictive network.
They do. And it's called the Blue High Performance Network. So those doctors, they have to designate a doctor in the high performance network, and that doctor has to refer them to specialists in the high performance network. And originally
Hey,
this,
Brent,
yes,
I'm sorry to interrupt. My ADHD kicked in. On the Blue Saver Silver EPO, the primary care doctor has to be in the Select Network and the Blue High Performance Network.
okay. Okay, good point. And the specialists do too, right, Robin? Or no?
The doctors you get referred to, specialists or whether it's another internal medicine or something like that, anything like that, any other doctor, they just have to be in the Blue High Performance Network.
Okay, but not the Select Network.
No, that's just for the purpose of the PCP.
Okay.
Okay.
And originally these doctors were associated with St. Vincent's here in Birmingham. Is that still the case, Robin? Affiliated with them?
Yes, that's the case. You know, there was the whole question that came up after they got bought out by UAB, how UAB was going to handle that. And I think we did lose some providers that wanted to just align with UAB and opted out of that. But no, right now that's still the primary network.
Okay, thank you. I just wanted to point that out so that there wouldn't be any confusion between these EPO plans around Birmingham and that statewide EPO plan, because I can, that could be confusing to someone if they weren't aware of those differences. So that kind of brings us to, since we've been talking about these networks, I want to point out something, and I'm going to go back to a Florence zip code for a second, just because I'm familiar with our doctors around here. And in a minute, we may look to make sure you understand about the Birmingham EPO and how you find those doctors. But
before we leave that, I see
yeah,
Wanda put a question in there. What about the hospital for those Birmingham EPO plans? And,
good question.
And Robin, I'm going to say St. Vincent's, and correct me if I'm wrong.
No, it's primarily St. It's primarily St. Vincent's. I don't think we have anybody else except for the St. Vincent's hospitals in there. There was some question at one point about like Grandview and things like that, but no, they're not part of it.
Okay. Does that answer that, Wanda? And Robin, I don't know if you can see it, but Wanda brings up a good point. St. Vincent's is technically UAB now, but I think we're still treating those different.
We're treated for the purpose of the EPO plans. It's the St. Vincent's, base locations. UAB and hasn't joined it. They do own it, but they're allowing us to right now, unless they change something, they're allowing us to treat the St. Vincent's locations as the EPO still. They're allowing that to stand. Nothing has changed, but they're not. It's going to be whatever was a St. Vincent's hospital location.
Yep.
Thank you, Brent, for watching that chat. So thank you for keeping an eye on that. And I'm sorry, I just can't watch that chat and do this. So thank you so much.
When you're presenting, it's tough to see, but I've got it up. So.
Okay, perfect. Thank you so much. All right. So what I wanted to point out next, since we're talking about the networks and how important that is, a lot of agents here on Health Sherpa will add doctors over here to the providers. And you're not going to get accurate results on every plan. And I just don't want you to overlook a plan that a member might actually have the doctors in the network, and you're just using this as the reference, and you give them incorrect information and they don't enroll in a plan that they really would want to. So I'm just going to show you an example. Okay, so here in Florence, Hillary De La Rosa is a primary care doctor, and she is in the Select network. I know that she is my doctor. And then Felix Morris is a pulmonologist here in Florence. And I know that he is one of those preferred medical doctors. So he is in that PPO network. I know he takes the select plan. But I want to show you what happens if you rely on this provider tool over here. Okay. So we'll just skip over these bronze and let's go down. I did notice it is accurate on the statewide EPO. It shows that both of these providers take the plan. But if you go down to the select silver, it shows that he does not, that Felix Morris, the specialist, does not take this plan. And so I would say just don't rely on this provider lookup tool at all that's on Health Sherpa. I think the better way to do it, and I have this bookmarked the way that, well, I'll tell you how you can get to it easier, is you can just say here on this select silver plan. Let me go back to it. Select silver. You can click on doctors. And here it's going to take you to the actual Blue Cross provider lookup tool. And this is just, I feel like, a much more accurate way to find out which doctors are in what network. Okay. So I put in our zip code and then I'm going to type in Felix Morris. Now, the specialists do not have to be in the select network. That's only for primary care doctors. But if you'll click here on view details, no, wait, that may not be the right thing. I mean, hang on, I think that I should have clicked on networks. Sorry about that. View networks. Okay, so it's only showing Blue Advantage there. Let me go down to this
Hey,
one. Here we go. I don't know why he's on there twice, but he is a PMD doctor. And so PMD is in that PPO. That's one of the networks that is under the PPO and the statewide EPO plan now. So just don't rely on the Health Sherpa tool. Use this directory. Robin, did you have something you wanted to throw in about this?
Well, I had started to say that when you pull it on our website, it irks me, but they pull from different databases, information from other plans, for out-of-state doctors and things like that. But you may find multiple listings, like right here where you've checked a different one, same address, same doctor, and it may say one doctor, it may say like the first one, just Blue Advantage. There's maybe multiple listings on here for the same provider. We report it when we get it, but there's reasons for it. I didn't get the answer I got as to why I was clear as Alabama mud, but I just wanted to bring it up that if you check the first one and you don't see anything, or it says check with your local plan, or it just has one network status, then scroll down and see if there's another one with the same address and check that one, because the one with all of the codes is going to be the most accurate. If you get one that just has like one network name, like the first one, Blue Advantage, or it has a message that to check with your local plan, then just scroll down and check the next one. It will be accurate. Like in this case, this one's saying PMD. You can safely tell them this doctor, this location is PMD, or is, whatever the network, if you see it on this one. Just because you didn't see it on the first one, if you find it on another listing right below, if it's listed on that one, you can safely say that. You can disregard what you saw on the first one.
Okay, perfect.
Can I go ahead and add real quick before I forget?
Yes.
When Wanda mentioned about it's UAB now, if you're looking up those hospitals, like the one on 810 St. Vincent's Drive, if you are looking it up on the status, it is going to say UAB first, but it'll say UAB St. Vincent. So if you just type in St. Vincent's, you may or may not come up, but that's how they're trying to kind of designate those St. Vincent's locations in our directory that are under UAB. They'll have UAB in the title, but then it'll say something like UAB St. Vincent's East or UAB St. Vincent's Birmingham. So I just kind of wanted to throw that out there.
Oh, that's good. Do you want me to put that in and show, do I need to pull that up to give an example, or do you think that's clear enough?
That's you. I just wanted to kind of throw that out there because I was looking at her question and I thought about it. You know, their names have changed, but that's how UAB is, and we are working to try to designate those locations on the EPO side. They'll say UAB, but it'll say UAB St. Vincent, UAB St. Vincent East, stuff like that.
Okay, awesome. And if you're a little unclear about how to know which networks are in that PPO or the statewide EPO, I have a video about it, but I will also just quickly show you how you can find that information. So just like under Select Silver, if you click on Plan Details, and then you come down to this Summary of Benefits and Coverages, and this will be the same on any plan you pull up. Here you're going to see a link right up here at the top like this. If you click on that and open that link, you're going to get this booklet, and it has everything about that plan you could want to know. So, if somebody asks you, does this plan cover an endoscopy or whatever, you can search it and you'll be able to find exact information about that plan. But then as far as the network goes, let me blow it up so it's a little easier to see. I think it's around page 11. Let me scroll till I can find it. Bear with me here a moment. Here we go. So examples of the plans, Alabama in-network providers. So these would be all of the networks you might want to look for. Most of the time, like for a specialist, it's going to be preferred medical doctors, but there would be times that some of these other networks would apply. So I just wanted you to be aware of how you could find what networks applied with which plan. But this network is the same for all the PPO plans and the statewide EPO plan. And I actually have this list in the 5th chapter of our ACA handbook under the Blue Cross Blue Shield information. So, you don't have to pull this up every time, but I just wanted you to be aware that this document exists and you can find information about almost anything that anyone could ask you about. All right. One more thing before we move on about these select doctors. Robin, if someone already say is in this Select Silver plan and they have a primary care select doctor designated and they want to move to the statewide Silver EPO plan, do we need to submit a new primary care designation form since they're changing plans, or will that designated doctor just carry over with them?
Theoretically, it'll carry over, but I believe those plans have a different prefix. I'm checking now. If they get have a different prefix.
Robin, they're the
sorry,
same
what?
prefix. They're the same prefix.
Okay. Then it should carry over. I would say, because I'm just be safe type person, I can see some instances where it might not, depending on how the marketplace handles the change or if there's errors they have to go in and fix. So it might be a good rule of thumb to just still consider, adding that designation. And if they use that link that you guys have created, that goes directly to me.
Okay, wonderful. Yeah.
So to answer that question, Heather, it should carry over, but to be on the safe side, I think it may be wise to do the link, and Robin can at least go in and look. And if it's carried over, she doesn't have to do anything. If it doesn't carry over, she can quickly add it to the
That's good. I think that's a good answer, because it is so, and for new agents that maybe have not heard this, I know I feel like I beat this horse to death or whatever, but these plans that require the select primary care physician be designated, you've got to help make sure that gets done, because the plan's not going to pay anything if that doctor's not designated. And so it's very, except for maybe some emergency services, but it's so important that you make sure that that gets done. And if you don't know where that link is, you can find it in that 5th chapter of the ACA handbook. I've got a lot of information in there about designating that select primary care doctor. I've got the link to do that there. So if you have any questions about that, feel free to reach out to me. But if you'll just look in the last chapter of the handbook, it's very clear there what you need to do. So just please help make sure that gets done. All right. So moving on, that's all the information I really had to present. But I did have some questions emailed in to me, or some agents even called and asked questions. So one question that I'm getting a lot is about HSAs. I've talked about this in a couple of previous webinars, and HSAs are going to be more popular this year because for those people that are slightly over the 400% of the FPL, if the enhanced tax credits are not extended, an HSA might be a good way to help them qualify to get a subsidy. And this is why the contribution to the HSA would come off of their adjusted gross income. So if someone's just slightly above that 400% of the FPL, they can make a contribution to their HSA as long as they're in a HSA compatible plan, and it could lower their income to the point that then they would qualify for a subsidy. And so the question I had is, which plans will be HSA compatible? And so let me find in a previous webinar, I had talked about, get up here, make this bigger. Well, I don't know why. There we go. All right, I had talked about what makes a plan HSA compatible. And so for 2026, I'll just read this. It has an annual deductible of at least $1,700 for self-only coverage, $3,400 for family coverage. And its maximum out of pocket, including annual deductible, does not exceed $8,500 and $17,000 for family coverage. And notice here, you can't be enrolled in a flexible spending account. You can't be enrolled in Medicare. You can't be claimed as a dependent on someone else's taxes. So let's, we can just go back and look at, go back to all of these plans. Of course, it's not going to apply to someone getting a cost share reduction like this, but it would apply to someone that's no longer going to get a tax credit. So, here this person's just going to slightly be over the amount to get a tax credit. So for let's just look at that statewide EPO plan, they would be paying $782. But if they could contribute to an HSA and get their income down, and the contribution limits, let me show you what those are, if I can navigate around to that. Okay, so for 2026, this is just a single lady that would be enrolled in the plan. So her contribution limit would be $44,400. And so I believe that would take her down to the point she would get a tax credit. So that would be helpful to her at that point. I know it might be hard though for her to contribute that much to an HSA, but she's probably going to pay more than that in premium. So you would just have to put the math to it and make sure that the member understood that they would need to contribute enough to the HSA, make sure their income, that's going to work out. I talk about that more in some previous webinars, and those are recorded on our YouTube channel. But you just yeah, Brent, speak up
Heather,
about this.
Can you scroll back up to the bronze plans?
Yes, let me go back to that. And this year, all bronze and catastrophic plans on exchange are going to be and I guess that they don't even have to meet this other criteria. Is that correct, Brent? Okay.
That's what I was going to say exactly, is the change in 26 all bronze plans are HSA qualified plans in addition to the catastrophic.
Okay, great.
So that is, we have a separate blue HSA bronze. We actually closed our HSA gold plan and we mapped all those people to the bronze plan. But for the change for 26 is all bronze plans are HSA qualified.
Awesome. And the catastrophic.
And the catastrophic. I don't think it applies to silver, but all
Okay.
bronze plans would be HSA qualified.
Okay. And so like on this statewide silver EPO, just, the way I understand it, it would not be HSA compatible because the deductible would meet the minimum limit because it's over $1,700 for self only. But the max out of pocket is $9,450. And the way I understand it, the max out of pocket could not exceed $8,500. Is that the way y'all understand that as
Correct.
well?
I would just look at it as any bronze plan is HSA qualified. I don't think any silver plans would be.
Okay, that's good to know.
Due to that reason, Heather, the maximum out of pocket.
Yes, because the maximum out of pocket exceeds the 8,500. So yeah, just scrolling down through here, it looks like that would be the case.
Yep.
Possibly this standardized gold might would. No. Yeah.
I don't think so, but
okay.
I could be wrong.
No, well, you're probably right. So, you just need to look at that really carefully. But just, I would say for most purposes, just count on the bronze and the catastrophic being what's going to work well with those HSA plans. All right. And then the other question I'm getting, and I know this is the question on everyone's mind, and anyone can just speak up about this that wants to. What are we going to do about if the tax credits are not extended? What are we, the enhanced tax credits are not extended? What are we going to do about our people over 400%? And we've talked about this. They're not going to get a subsidy anymore, and those rates are looking really high. And so the HSA paired with the bronze or catastrophic plan might be one option that I thought of. And if those high deductibles scare people, which I can see that they would, you could think about layering on like a hospital indemnity plan that could cover, would give them some money if they did have a hospitalization. You could just look at some of those like Manhattan Life, the hospital indemnity. You can set a set amount that if they spend 24 hours in the hospital, they will get that lump sum of cash, and that could help, cover the deductible or even the max out of pocket. If they're healthy and can pass underwriting, those plans are not very expensive. I also would suggest, I've printed out, NABIB sent out a tip sheet on how to call your representatives. It has a link that you can click on, put in your zip code. It will tell you all of your representatives, your senators, representatives, phone numbers. I called yesterday. I know probably most of us are not used to doing that, and I was a little nervous when I called, but it went great. I just left a message for Coach Tuberville, but the lady at Katie Britt's office was super nice. I just explained to her, where I lived and what I did, and just, gave her an example of a situation that I'm seeing with some early retirees that make $100,000 and their premium's going to be $3,000 without a tax credit. And, just ask for their help. If there was anything that she could do to help these Alabamians that are being put in this really difficult position. And the lady was super nice and said she would pass my message on and for me to have a blessed day. And I may be naive, but I do really feel like that we should encourage our members, if they're being put in a bad situation, to reach out to their representatives. I think they want to hear the stories of the people they represent. And, I'm just kind of telling mine to let's set tight for a minute. We don't have to make a decision until, maybe the beginning of December or so. And let's just hang on and see if something happens with those. Brent, Robin, Lee, does anybody want to add anything about that?
You know, I think that's one of the most frustrating things about this open enrollment period is the unknown. And we actually put together kind of our stance, talking point. And Heather, I'm going to send it to you and you can share it with the group.
Oh,
But
good.
basically, and I'm just going to read it. In recent years, expanded subsidies help lower premiums for many individuals and families. However, those enhanced subsidies were temporary. As of now, it's unclear whether they will be extended or replaced by new legislation. This uncertainty is affecting the tax credit amounts for many members across the country. So kind of back to your point, Heather, is let's sit tight for a couple of weeks and see what happens if we come to an agreement. But I'm hoping and praying that they will be extended. But obviously we don't know that as of today.
Hey,
Thank
Heather,
you. Yeah, Lee.
since you got that screen pulled up there, do you mind putting in $100,000 income and just clicking back and forth between 25 and 26 like we did yesterday?
Yes. So do we want to put it in maybe for the early retirees?
Yep.
Yeah.
Since they tend to be the ones that are going to be affected the most. Okay, so 62 and 63-year-old, that would be a male. They have a household of 2, and now they make $100,000.
And with
So
two
let me,
people, that's probably too, that still gets them out of the tax credit with 2 people. doesn't it?
yeah,
It does.
Yeah.
I think it's like 83,000.
Yeah.
or 86. It's right. It's in the mid
Well,
80s.
For 84,600 is the new 400% level for 2 people.
Oh,
Okay.
84. Okay,
84.6. So anything above
86.
anything above that, Heather, anything
Okay.
before 84,600, they would be out of the tax credit range.
Okay. Yeah. And just so everybody knows, that poverty chart that we keep referring to, it is in the ACA handbook. I believe it's chapter 3. I'm going to have that printed out. I don't have all those numbers committed to memory, but I'm going to have that printed out and in front of me, because if people are close to that cliff, that 400%, we need to make sure that they are aware of that, because they could have a huge tax repayment when they file their taxes, even if they just go over by $1. So in 2025, this couple that we're talking about, these early retirees here in Florence, they would be paying $638 for their Select Silver plan. Let's 638, is that what I said? Let's go back now and change that to 2026. This same couple in Florence, Alabama would now, for Select Silver,
Wow.
yeah,
Jeez.
yeah. So, that's going to be a challenge for it.
I think as a salesperson, you always find yourself trying to justify things, and to make everything okay. I think with a jump like that, you would make yourself look silly trying to gloss over the fact that that thing just went up to $3,000,
Yeah.
and the more we can educate ourselves on what's going on politically, not to pick a side or to say one's right or wrong, but to say, don't call Blue Cross about this. They did not just take you over the coals. This is a national thing that's going on, and there's a reason for it, and if it doesn't get fixed, I don't know how many people keeps that plan.
Yeah.
No,
I don't see how they can.
no, I don't either. And so, in that situation, they might can move down to even a catastrophic plan is going to be very expensive. And a lot of people at that age have some major health issues and they need better coverage than that. So,
and scroll down a little bit, had a look at the bronze. So they were paying $631 for Select Silver. And even if they switched to bronze, they would go up to almost 2,100. That's the population I feel terrible about. I mean,
They are definitely in
yeah.
sad situation there. I will send out go ahead, Robin.
No, this is Sherry. I don't know why
hey,
it says I don't know why I'm Joe Boxer, but anyway, I need Lee's outfit.
Yeah.
I have a couple that's in the exact situation that we're talking about, and they're paying $1,700 a month for Cobra. And she is Medicare eligible as of December 1. So we got that resolved. I haven't spoken with him to see what that Cobra is going to look like when she comes off. But he's 63, and I was sure hoping that I could give him some relief on that, but it's not going to happen, is it? Because with her coming off, his income's still going to be a little over 100,000.
Yeah.
Yeah. I can take off lady here. We could see.
And Sherry, I'm working with a couple in the same scenario, and I did the numbers for them, and you would think, okay, one person's coming off, it's going to be cheaper, and it's really not that much cheaper.
Wow.
Because
I just hope he planned far enough ahead that he's going to have his Cobra for 18 months. If he's only 63, that's not going to look great.
And that's usually the first thing we do is let's compare these premiums to Cobra. Right. And now, with the tax credits the way they have been, with the tax credits, these plans were cheaper than Cobra. Now, maybe the encouragement is stay on Cobra for the 18 months as long as you can. And hopefully this thing will be sorted out. But I feel for you having to explain that. And I really feel for them. Just how can people afford that?
Yeah. They can, but that's a lot of other things they could be doing.
Yeah.
Yeah.
Well, and Brent, Heather, do me a favor because we're kind of freelancing now. Scroll down, go back to let's see, put in an income where they get a good tax credit, like 16,000 or something.
Okay, so we want to add the spouse back.
You can leave it like it is.
Okay.
Put it at 16,000 and then go find the 5 cheapest silver plans.
Oh, are you talking about like if I went to the Health Sherpa that would show all of the plans for the state?
Yeah, that's right. This is just going to show Blue Cross. Yeah.
But I can do that if you want me to take a second.
If you don't mind, let's do that real quick.
Yeah, because this was really exciting to us the other day when we saw that.
Well, and it kind of demonstrates what we were just talking about, the bind that we're in with premiums, because if Blue Cross was the only carrier on the market, you'd look at their premiums and you'd say, good Lord, how do you charge that much? But wait till you see what these other companies are charging for the same coverage.
Yes, that is very true. All right, why does it keep going to this?
Hit log out.
Oh. Okay. Oh, when that comes up again.
That might help you.
That's still.
Well, we don't have to. The cheapest Blue Cross plan or the statewide EPO, I think comes up to like $4 or $5 a month. In a lot of counties, the next cheapest carrier is like $50. Yeah. It's a huge gap.
Yeah, it was. I can't get to that. If someone had access to that though, you can see what we're talking about. It was very encouraging to
Heather, you can just key in healthcare.gov.
Okay.
Just go.
.gov. Okay. Yeah. Oh yeah, this may have been what we did the other day, Lee.
See plans down there.
Okay.
And then zip code. What do you want to use? Skip that.
Okay, we'll do just you. So Lee, do you want me to do like the 47-year-old female with 16,000, or do you want us to do a different age? What would you, or just,
That'd be fine. I think it'd be cool to look at a 40 and then a 62.
okay, so let's do a 40-year-old female and we'll continue. Confirm that. And what do we want to put her income in as, Lee? Do we want her to get a tax credit?
Yeah, do 16,000 or 16,500 or something like that.
Okay. And then view plans. Next. Let's see, all plans. Do we want to just look at the silver, maybe?
Yeah, that's a good idea.
Right, silver. So here, and these are sorted by the lowest premium. So you
Okay,
see.
And Heather, if you want to, just pretend like we're customers and just kind of gloss over these as you scroll over them. You know, if you're going to tell the feature plan and then maybe just a couple of the other plans and, you know, what's different about them. But then make sure we get down to these other carriers.
Okay, I will. So the cheapest silver plan for this lady would be this statewide EPO, this statewide silver EPO, which we've talked a lot about today. And notice that premium would only be $11.41. And of course, I would go into more detail if you were an actual client. And then the second cheapest silver plan is going to be the standardized statewide silver at $27.70 EPO. And then the third cheapest is the Blue Cross Select Silver at $29.46.
So the difference in that one and the cheapest one is basically the out-of-state coverage. I know there's small deductibles and that kind of thing, but it's the out-of-state coverage. So the reason you'd pay the 29 instead of the 11 is if you wanted out-of-state coverage.
Right, maybe if you were in one of those border counties.
Yeah, okay.
And then the fourth cheapest plan as well is still Blue Cross, and that is the standardized silver. And it takes us to get to the fifth cheapest silver plan to see a different carrier. And then we see United Healthcare there. And, you know, then sixth. And then I guess that one's seventh. That would be Better. So, you know, it's definitely a good time to be selling Blue Cross. This is fantastic to see this. And I think if you just get in front of people, if they're wanting to get insurance, then it's a no-brainer to pick Blue Cross. You know, the best network and great customer service and the cheapest rates. So,
all right, do me a favor, change that to a 63-year-old.
Okay. $63-year-old female. Continue. Confirm. And do we want to raise her income or do we want to keep her here?
Nah, leave it like that.
Okay. So let's see about the okay, I think we're still filtered for silver. Okay, so she's actually that statewide silver plan. Her tax credit will cover the entire premium.
So here's the point I wanted to make, just kind of touching on marketing a little bit, and then I guess something cool about the quote tool too. But the older they get, and Brent, I can't talk about the mechanics here, but I just relearn this every year. I told Heather it's annoying when the same light bulb goes off 11 years in a row. But if you were looking at a sector to market to with ACA, it's 60 to 64 years old, because the way the calculator works, the tax credits are bigger the older you get. So they're covering a larger portion of the premium. I don't know how that works out, but it just does. And so if you find older people, 60 to 64 years old, they're going to have the best shot at having zero premium. And that's also the best way for you to funnel into your Medicare book of business. You know, so the young people are great. You're going to get paid on them too. But as far as your business structure goes, and then the ease of writing it, if you can find 60 to 64-year-olds, to me, that's the sweet spot. We're not good at buying leads. We never have been. We've tried to buy them, before, and it's a bunch of junk that we don't like to filter through. But if you had a good lead source and you could set a filter on age, or if you're doing mailers, or if you're doing Facebook ads, or whatever you're doing, if you could focus on the 60 to 64-year-olds, I think your closing rate would be higher. And I think you would write a lot of people that are just going to feed right into your Medicare book of business.
Yeah, and I've seen people do, little educational classes. Don't let health insurance stop you from retiring early, those types of things to target those early retirees. More and more people are wanting to retire early, and it's just a double bonus. You can help them with ACA, and then there they are when they need Medicare. And most of the agents that work with us also do Medicare. And so that's just a great strategy for building your Medicare business and your ACA business. I think that's a great group to target.
Yeah, and just as far as marketing goes, I don't know who on here is new and trying to figure out how to market ACA, but if you're having Medicare appointments, always bring it up, because their spouse and their kids, one of them will probably qualify for ACA and need help with it. We've seen and had a lot of success just going to small businesses and asking if they offer group health. If they don't offer group health, the thing that we would like to do is ask permission to come sit in the break room during open enrollment season and just tell them they can send their employees to you one at a time, and it won't, 10 or 15 minutes a piece, and you can explain their healthcare options to them. So, that's a good way to do it. Of course, you can buy leads if you want to, but this year is exciting as a salesperson because we've got the 4 or 5 cheapest plans in every area. Our only job is just get in front of people this year and find people that need help. So there is a little bit of doom and gloom with the enhanced tax credits, but there's also a lot to be excited about. So Heather does a great job putting a lot of videos and content together. She's done some on marketing, but if you're trying to figure out how to market these plans and you need help with that, please reach out to us and we can talk about some ideas with you.
Yeah, and when I sent out this recording, I had Angela, the lady that helps us with our flyers and business cards. She made up just a generic, ACA flyer that just gives some information. It has a place at the bottom where you can add in your phone number. You won't be able to type it in, but you can maybe print out a label or something and stick it at the bottom that would have your information, your QR code. Don't forget about that. That's specific to your Health Sherpa account. Someone can scan that, even get a quote, even enroll, and that's still linked to your MPN. So you might want to print out some labels and stick at the bottom of that if you don't already have something. And then just everywhere you go, pass them out. I give them to my husband when he goes out at lunch. I'm like, pass these out when you go, wherever they go to eat. He just leaves my card or something. So really, anywhere you go, there's going to probably be somebody that knows somebody. If they don't need insurance, they probably know somebody that does. And I do some posts on my social media. It's just super easy to get the word out there. And once people know you do it, I don't know how, but you just end up getting a ton of calls. My phone rang all day yesterday. I was still getting calls at 7 o'clock last night. And they say, we've heard you help people with health insurance. And so it's a good time that people are needing help too. And they need an experience, or they need an agent that understands the plans, because if you just go on healthcare.gov and you see all those plans, you're not going to understand which one's right for you. So it's a good time to be able to really help people as well, help them navigate this. And so that's all I've got for today. Brent, Robin, Lee, anybody else want to add a closing remark? Or if you want to unmute yourself and ask a question, we'll just kind of begin to wrap up.
I'm good, Heather. Great job. Good information. And happy to answer any questions.
Okay.
Yeah, I'll say bye too by saying thank you very much, Heather. You always do a wonderful job. And I know I can speak for Robin and Brent and anybody else that answers phone calls and questions that
You're very valuable and much appreciated.
Well, thank you, Lee. I'm glad I can help. So I will get this recording sent out this afternoon and just thank everyone for being on. Brent, Robin, thank you so much for your time. I know it's a busy time for both of you and we appreciate you being on here with us. If we didn't get to your chat question, I'll try to look back at those, but you know, feel free to email me if you think of anything else you want to ask. So if not, then happy Halloween and happy OEP. I hope everyone has a very successful OEP. Thanks for being here.
Thank you, Heather. Thank you,
Thank you,
Brent,
Heather.
Robin.
Thank you.